What is going on, everyone? Today we have two awesome guests that are both PGY1 Residency Program Directors, and we are going to talk about the transition from P4 to PGY1. Hope you guys enjoy.
Hi, I'm Scott Nye. I'm a pharmacist at a large academic center. I work in a cardiac surgery ICU. I'm also the PGY1 program director for 6 PGY1 residents. And I'm originally from Minnesota, born and raised here, did my education at the University of Minnesota, and I did a PGY1 and then a PGY2 in critical care.
My name is John Leung. I am a psychiatric clinical pharmacist. I am the assistant program director for a PGY1 program. Working with Scott, and I have a mostly inpatient practice and small ambulatory care practice in psych areas.
So today's video, as we mentioned at first, is just to give students some advice or tips that you might have in this transition period. Whoever wants to start, I'm sure there's a lot of ideas that you may have. Let's start with John this time. What tip or advice you might have, and feel free to chime in, Scott.
Yeah, I think one of the most important things coming into residency is changing your mindset in terms of what skills you might think you have in regards to time management. During school, you may have lots of projects, but a lot of times they don't stack or they're not going concurrently. So when you get in the residency, you might have a QI project, a research project, a grand rounds to give, all in the setting of your ICU rotation where you have other expectations. It can be kind of overwhelming for an incoming resident, and so really trying to get ahead and learn various skills for time management I think is super crucial for an incoming resident.
Yeah, I completely agree with John. And just to emphasize it too, there's always peaks and valleys as it goes along with the year, and you'll notice that as you go. We see that there's often one big peak in the fall as things first start coming together, and then also the springtime too. So we notice those as rather stressful times for people. So just setting up those expectations, trying your best to stay as on top of things as you can, but also understanding that you will get behind at times.
Yeah, definitely. And while there may be, swells in work, Scott mentioned those valleys or trough time. So when the work is low, we as program leadership really encourage you to get ahead and stay on top of, what's next? Can you get jump started on the structure of your manuscript, or thinking about the topic for your grand rounds that's even 2 grand rounds away? So really making use of all that time, even when it seems like it's downtime.
I think the other tip I like to think about for people coming into residency, as John mentioned, changing the mindset. It's also to think about what expectations you have for the year. I know you're so excited getting done and getting through your examinations and then just getting started. But one of the most helpful things I think in our minds when we get to sit down and have baseline interviews with our incoming residents and our brand new residents is, what do you want to focus on? How can we tailor the year to you? Because we can give you a variety of, patient experiences. We can give you more teaching or less teaching depending on what you want, as long as it's meeting your program specific requirements. If research is something that's very interesting to you, that we can emphasize that or de-emphasize it. And telling people early on allows us to plan and create that year and that timeline for you. So take some serious thought about what you see your future looking like and how we can help you achieve that and tailor the residency for you.
Yeah, definitely. And as Scott mentioned, you may have various interests. We may not be experts in those areas, and so it's important that you maybe come to us and maybe we can find a mentor for you, whether it's research or a specific clinical area, or you want to write a paper or case report up. Those are things that also are important mentorship throughout the year.
Yeah, and that makes me think of another thing, as John's mentioned so many times throughout our residence, that mentorship is so crucial. I mean, that's really how you grow even beyond just the year as your resident. But sometimes mentorship can be a little awkward too. I really like how you've put that before, is that if it was easy, everyone would do it and you wouldn't grow as much. But finding that mentor that'll push you outside of that boundary that you're used to seeing, I really like how you put it that way to our residents and kind of show them that at times it's going to be difficult and they're going to stretch you, but that's really where you grow the most.
Yeah, definitely. And we have this sort of, I think, concept that mentor-mentee relationship has to be in a box in a certain way. But throughout the course of your year, you may have mentors for various different topics, for research or for your grand rounds. And those are all very sort of finite projects. But we really encourage residents to also go out and find mentors for life, for interest, for hobbies, because we recognize that work-life integration is so important as well in the context of a high-stress year.
Yeah. Also, too, finding those people that'll help emphasize those soft skills that you're not thinking about on a day-to-day basis. You're trying so much to understand how to take care of that patient, be a pharmacist for the first time, be on your own. But it's also so much about how to interact with that team, how to set up good self-reflection goals and abilities to set goals throughout your career so you continue to advance even afterwards. Residencies is a time you're going to get a lot of feedback, but as soon as that residency is done, that feedback really goes off the cliff and drops down and you don't get nearly as much. So we need to teach you how to do that yourself and be able to hone those skills so you continue to grow, because this year will go by fast for you.
That's true. And we really push self-reflection as a soft skill that's really important for residents. As Scott said, you're not going to get a lot of that feedback after residency. So if you have the skills to be able to say, hey, how did that go? Or how should I approach a situation? But, so really kind of thinking about all of the mentors you had, all of the preceptors that you asked questions to kind of pull that together and apply down the road.
I think too, as you're thinking about it, we talk so much about what you gain and, what all there is to do, but don't forget to have fun. Your co-residents and the people you meet are going to be people that you interact with the entire life. We always say pharmacy is such a small world. It's so true. And then as you learn that you're going to be so close to your residency class, if you have them, if you're more than one resident of that institution. But as long with your program directors and mentors, you're going to continue to see these people throughout your career, continue to develop, advance, and it's fun for us to see you keep growing even after you've left our program. That's probably one of the most enjoyable things.
In this phase right now, it's about August, May time frame. The students that have to move for their residency must be under a lot of stress. Sometimes it could be, let's say, from Florida to Washington State, and that's a very stressful time. How does a student balance moving logistics with licensure, with finding a place to live? Like, what are some practical things you might give to a student about all of those things and how to juggle that?
Yeah, I think the first one that comes to mind is trying to prepare as far in advance as you can of getting that licensure exam scheduled. Oftentimes boards of pharmacy don't turn around instantaneously like you might hope. I know our state specifically takes a few weeks, and it can sometimes be a little bit of a delay, or during that downtime you can be studying, but once you get that exam scheduled, I think then you can really focus on moving and the aspects related to that. But at least for our town, I know have to be able to find housing quite quickly, and so hopefully that's something that you can either do from afar via FaceTime or Skype or something like that. A lot of realtors or apartment places will help you do that, or utilize the residents that are already there to help find places that you can live. And then the move is, I remember doing it on a weekend one day, and it's just sometimes the not the fun part of it.
No, I remember a U-Haul from Ohio to Virginia, and then starting the next Monday and trying to get just settled and get started.
I have heard a story of somebody taking a trip from Northeast, and they're actually just driving, and they're saying as long as it takes them to get here, up to 5 or 6 days, just to get to where we're at, just to have fun and get to see a little bit of the United States one last time before the start of residency year. So it's kind of a fun way to approach it, to take that one last trip, relaxation, before you get into a busy part of your life.
Yep, definitely. And our residents, because we've had some stay on early commit for PGY2s, they've already reached out to our incoming residents. So if you weren't able to make those connections, either reach out to the 2B program director or somebody there, because certainly they have information if you're still trying to tease out where in the town or city you might live, or some of those different amenities that might be available.
Yeah. If you haven't thought of it yet or have your place yet, you might also want to think about public transportation or parking or transportation to and from your site. I know depending on where you are, it could be very difficult or different, and so it may kind of steer you down one place to live or not, just based on that as well.
I have another unrelated question that's a little further out from the move and the start of residency. A lot of students that come into residency are super ambitious. They just want to plan out their whole future and think very far ahead. And oftentimes I get questions from students that start asking me about PGY2 when they're not even in PGY1 yet. When do you think is the optimal time to start thinking and looking for PGY2, knowing that mid-year is right around the corner?
I guess I would say I don't think it's ever too soon to at least have a career path or idea. Scott and myself's stance is we're not going to push you one way or another, but we're going to help facilitate should you have an interest in going into critical care and say, hey, it seems like you have this interest. Let's get you a rotation so you can make that decision. It's not uncommon for a resident to come in and have an interest and they're like, 50-50 ED or critical care, I don't know. And so I think, our role and really any RPD or ARPD's role should be to help facilitate those decisions, because it's pretty stressful. You're moving to a new place maybe, and then you're like, I got to decide what I'm going to be doing in 2 years and then the rest of my life. That can be pretty stressful. I don't know, Scott, do you have any other thoughts?
Yeah, I think, and also don't be afraid to embrace a change if it happens. Every single year we have people come in going down one path, and then what happens is you have a rotation that you love, or it's a rotation maybe you thought you would love and you don't like as much as you thought you would. And completely changes maybe your mindset of where you're going. I think just be open to that. You don't have to decide until you have to go through match for PGY2 if that's the way you want to go, or if you want to pursue jobs or careers or fellowships afterwards. So be open to that change. We definitely have a good group of people that exactly knows what they want to do, and we have a group of people that changes throughout, and then we have a group that comes in and says, I honestly don't know exactly what I want, and I want that guidance too. And that's even more helpful to tell us that early, because then we can set you up to meet people that might be able to help you along with us to find your path.
Definitely. And keep in mind your RPD or ARPD, they just have had their career path. So Scott and myself would encourage anyone to talk to as many people as they can, and that doesn't have to be just pharmacists. They could be family members, because they know they can just read in somebody's eyes if they're not quite sure about something. And so we really encourage folks to get different perspectives on different career paths.
So maybe two more questions, and we'll maybe wrap this video up with the last question just being like a final statement or tip that you might have to a student. But before that, one question that I was thinking of is, a lot of these students are fresh out of rotations. They just did a whole year of them. What would you say is the biggest contrasting difference between rotations as a student and jumping into rotations as a resident?
I think as a resident, you get treated a little bit differently, have higher expectations for sure that the preceptors put on you, have a higher level of expectation of your knowledge, and now you have a license where you never had one before as a student, and so you're verifying those orders, you're writing those notes, you don't need people to sign off on them, you're no longer just underneath somebody. It is your license and what you're doing, and you're doing patient care on your own.
Yeah, definitely. I think another important piece would be, as maybe you've had some strong clinical rotations, ending your year as a student, you kind of feel, pretty high or on top of the world. But coming into residency, you kind of float back to the bottom of the totem pole again. And so I really think, maybe you had some autonomy, or you felt pretty autonomous in your rotations, to really kind of let that loose and let some flexibility to allow feedback from your preceptors, from other colleagues, from the providers or doctors, etc. Because it's going to be a very feedback heavy year, and so if you're not used to that because of you've advanced through your APPEs, it might be kind of a shock when you get all this feedback coming into residency. So just be open and accepting, and really think about the feedback that you receive.
Why don't we go ahead and wrap the video up, but before we do, just any last minute comments, that nugget of advice that you want to give to these students that are about to start residency very soon?
The year goes by really fast. Take some time, stop, think about how much you've grown. When you take a moment and you look back, you grow so fast, and it just goes by so fast, or goes so quickly that you'll really enjoy the experience. But it's hard. It's a lot of work.
My kind of tip would be, if you're feeling maybe a little nervous coming in, congratulate yourself. Stop and say, I made this, I matched, I'm in residency, I'm doing what I want to be doing for patient care. And that's quite a feat, because there are, quite a few people that haven't matched, or, there's many more candidates than possible spots. So congratulate yourself, and, ride that out a little bit, take that feedback through the year, and grow, as Scott said.
All right. Well, John and Scott, thank you guys for your time. If you have any questions for them, okay, if we post your contact information, below in the description, feel free to reach out to them.
Yep.
And see you guys next time.
All right. Thank you.
Thank you.